What exactly happens in the body when someone has multiple sclerosis? This complex condition affects the nervous system in ways that are both fascinating and challenging. In this video, we'll break down the science behind MS, uncovering how it impacts the brain, spinal cord, and nerves, and why understanding these processes is key to better treatments and care. Multiple sclerosis is a devastating disease that affects 2.8 million people worldwide. But did you know that 1/3 of those cases are in the United States? And it has been on the rise over the last decade. MS is an autoimmune disorder where a person's immune system attacks the protective covering of the nerve cells in the brain, spinal cord, and optic nerve. This protective covering is called the myelin sheath, and you can think about it like insulation around an electrical wire. When that insulation gets damaged, the nerve fiber becomes exposed and signals slow down or just are completely dropped. After the damage occurs, special cells called oligodendrocytes are able to do some repairs, but it's not perfect, and the results are visible scars on the nervous system. This is where the name comes from: multiple sclerosis, or multiple scars. There are 4 types of MS that can vary by how they present: primary progressive, relapse remitting, secondary progressive, and progressive relapsing. Primary progressive MS only accounts for 10 to 20% of all cases, and it presents as steadily worsening symptoms over time. Relapse remitting is by far the most common, and it accounts for roughly 80% of the cases. This type follows a pattern of an acute flare-up that lasts for days or even weeks, but then symptoms back off and stabilize for months or years before they flare up again. Sometimes a person returns to their prior baseline, but usually there's some amount of damage that can't be repaired, so they don't fully recover. 65% of those individuals will go on to acquire secondary progressive MS, where the flare-ups die down and their symptoms steadily worsen over time, just like primary progressive. Lastly, some will have a combined version called progressive relapsing, where their symptoms continue to steadily progress in between the flare-ups. Unfortunately, there is currently no single test that can get you to a diagnosis of MS. In fact, 1 in 5 people with MS are initially misdiagnosed because of how varied the symptoms can be. The most common symptoms include a loss of vision in one eye, sudden weakness or numbness in an arm or leg, and fatigue. Someone also might experience tremors or spasticity, difficulty walking, issues with bowel or bladder, sexual dysfunction, or a banding sensation of pain or tightness around the chest, known as the MS hug. None of these symptoms are specific to MS, so your doctor would need to do some more digging before arriving at a diagnosis. The first thing is a comprehensive physical and neurological exam that looks at vital signs, strength, sensation, reflexes, coordination, vision, and blood tests that can rule out other conditions that mimic MS. If there are concerns, the doctor might order an MRI of the brain or spine to look for those characteristic lesions in the nervous system. Lastly, a spinal tap can be performed to see if there are abnormally high levels of white blood cells or antibodies in the cerebrospinal fluid that would indicate your central nervous system is under attack. Despite decades of research, the underlying cause is still unknown, but we do know several things that will increase your risk. Overall, MS is still a rare disease that only affects 1 in 1,000 people. Typically, the age of onset is between 20 and 40, and women are 3 times more likely to be affected. We know that genetics can play a role since your risk doubles if a parent or sibling has been diagnosed. But because there are over 200 genes associated with MS, genetic testing can't reliably predict whether or not someone will develop the disease. Caucasians are much more likely to be affected than those of Asian or African or Latin descent. But the biggest risk factor seems to be where you live. Most cases of MS occur between 45 and 65 degrees of latitude, and your risk increases about 1.5% for every degree of latitude you get away from the equator. We don't exactly know for sure, but this is likely because MS is also associated with low levels of vitamin D. And while there are dietary sources available, we typically get most of our vitamin D from our skin when it's exposed to UV radiation. Higher latitudes means less sun, which means less vitamin D. We also know that having another autoimmune disease like psoriasis, type 1 diabetes, or IBS can also slightly increase your risk. And just in case you needed another reason to quit smoking, some studies have shown that it can bump up your risk factor by up to 50%. And if you are diagnosed, it also increases the severity of symptoms. Environmental factors like exposure to solvents, heavy metals, and air pollution might also play a role, but the most significant one seems to be a common viral infection. It took 20 20 years and 10 million participants, but in 2022, researchers found that there was a 32-fold increase in the onset of MS after someone contracted the Epstein-Barr virus, which is the same virus that causes mono. But this still only represents a small piece of the puzzle, since 95% of adults will be infected with this virus at some point in their lives, and most of us never develop MS. We've known about MS since 1868, when it was first described by a French neurologist named Jean-Martin Charcot. But early treatments were ineffective and often dangerous. They included arsenic, mercury, deadly nightshade, and injecting the parasites that cause malaria. Thankfully, our toolkit has become both safer and more effective. There are currently over 25 medications that are generally well tolerated and can either treat the symptoms or even slow the progression of the disease. If a person is experiencing an acute flare-up, the first line of defense is usually IV steroids. But if that doesn't work, plasmapheresis is the next best bet. This is kind of like dialysis, where the plasma is removed, filtered, and then returned in order to take out the disease-causing antibodies. But when figuring out the best treatment approach, it's important to remember that the best results come from having a multidisciplinary team that is familiar with treating MS. This includes rehabilitation specialists like occupational and physical therapists such as myself, who are not only focused on restoring and preserving function, but also understand the unique challenges that MS can bring. So choosing the right one can make a lot of difference in the outcomes. It's kind of like going to a proctologist for cataracts instead of an ophthalmologist. Technically, both are surgeons with medical degrees, but they specialize in treating very different things. One of the most important things that they need to understand is that fatigue is fundamentally different when you have MS. There's actually two different types: primary and secondary fatigue. Primary fatigue results from the damage that happens in the central nervous system. Although it's not fully understood, the thought is that it just takes more energy to send and deliver messages to the other parts of the body, and that causes a buildup of fatigue. Secondary fatigue is caused by all of the other issues that can emerge from MS. This includes pain, muscle spasms, depression, disrupted sleep patterns, or just having to go to the bathroom more often. Understanding and recognizing the different causes will determine the best treatment approach. But no matter what the case is, it's important to know that your batteries aren't as full, and it's going to take longer to recharge if they're drained. When I'm treating someone with MS, I am constantly monitoring their exertion levels and their quality of movement. Once that starts to degrade, it's time to call it quits, because getting to that point of fatigue means it's already too late. Life doesn't stop after our session is over, and people still need enough in reserves to get through the rest of their day. Another consideration is something known as the Uthhoff phenomenon. This is when symptoms worsen with increased temperatures. It only takes a half a degree of core temperature rise to trigger it, so it's important to watch this during exercise and take the appropriate steps to manage it by using ice packs, taking frequent sips of water, or using a cooling vest if it's available. Unlike most orthopedic conditions that will benefit from general strengthening around the affected joint, the exercises for someone with MS must always be functional, because neurons that fire together wire together. If someone has difficulty walking because they have weakness in their hips, then doing a bunch of clamshell exercises isn't going to do much good unless they're also trying to bring back the Charleston. I hope you enjoyed this video, and if you are someone with MS that hasn't had much success with physical therapy in the past, I would strongly encourage you to find a PT in your area that specializes in treating neurological conditions like myself. Remember what Isaac Newton said: a body in motion tends to stay in motion, and that applies to way more than apples falling off a tree. Thanks for joining us today. I'm Steven the PT Doc, and I hope this helped.